Hi everyone, I'm Ian Harvey, massage therapist. Today I'm going to be showing kind of a case study on a particular massage client. She is a climber and she has complex elbow pain. If you'd like to skip to the part where I work on the elbow or skip to any particular part, click down in the description. And just as a reminder, there are a lot of ways of working with this kind of pain and this kind of client. Trigger points, more direct work, more active work. This is kind of my myofascial way of approaching chronic pain. So I've got Jess here with me today. So Jess, so tell me a little bit about your elbow. It's your left elbow, correct?
It is, and I've had this issue for about 3 years.
Okay.
It's an overuse injury from my work.
Okay, tell me about your work. Tell me about what started this aggravation.
I am a professional rock climbing guide, and when I'm guiding, I have to do a lot of repetitive motion that usually involves ropes. So I'm either pulling ropes or I have people who I'm belaying and I have to move the ropes up to have a progress capture, so if they slip, they're still safe. And it's a very repetitive motion and it's always under tension. So
Now, when you feel this, where do you feel it?
it moved around for a long time, and lately I feel it more in the back of the joint, but it's been from either side to the biceps, here in the front. It feels deep in the joint sometimes, other times it's more superficial, but lately it's been affecting me in the back here by the tricep.
Are any of these tender to the touch?
Yes, I'd say most of them.
Okay.
With a little bit of pressure, a little bit of digging around, they all hurt.
Do you feel anything further down? Do you ever get numbness, pain, tingling in your hand?
Nowadays, no, but I have experienced that in the past, and the numbness would come down mostly into these two fingers, pinky and ring finger, and it would feel tingly, and there's something going on in the nerves there.
And how about further up into your shoulder? Any shoulder pain or dysfunction?
Nothing major. I have a history of shoulder problems, but they don't seem related to the elbow injury.
Okay, and further up, any neck or headache?
Nope.
Okay, all right. So to start, I am going to give some attention to the neck. My client did not report any current or past neck pain, but whenever there's elbow pain, I do want to give some attention to this area. The fact that she has a history of some tingling and numbness does make me want to work with where this brachial plexus originates and where it passes under the clavicle, etc., etc. The more likely culprit for that fourth and fifth digit numbness and tingling is near where that ulnar nerve passes by the medial epicondyle. So I'm thinking that her wrist flexors are involved there. Based on where she showed me her pain was, I'm wondering about triceps and biceps. I'm wondering about wrist flexors and extensors. So instead of hyper-focusing on where that pain currently is, which is primarily the distal triceps, I'd like to focus on all of those things that attach near the elbow and the nerves that serve that area. So I'm going to come to this left side and do some nice spreading and opening work on the neck, on the chest. I do have some jojoba oil on my hands here, and I'm going to start with my standard neck pec fascia stretch, allowing my broad open hand to kind of iron the upper pecs out in one direction, while my soft fist runs up the side and the back of the neck. So nothing here is too specific. I'm just thinking about these broad sheets of fascia. And I'll repeat that a couple of times. Now that I've got this area kind of opened up, I've got the neck over to one side. This is a good time to start warming the area, just with some nice broad petrissage. So I'm grasping this trapezius tissue. My thumbs are including the scalenes just a bit, so I'm kind of outlining the upper portion of the clavicle here, just coming just superior to it. And as I press toward it and draw downward, that's drawing that tissue of the scalenes outward. So it's kind of an indirect way of working with those scalenes. If I want to work more directly with this lateral and anterior neck, I can use this broad surface of my dorsal phalanges, creating a big flat surface, and draw that tissue down and out. So I'm not trying to compress these scalenes down toward the neck. I'm trying to draw this tissue outward. So think skin more than you're thinking muscle. I can do that with this same side hand. And the less oil or lotion that you use here, the more slowly that you'll be able to move. And I'm going to go back to working directly with trapezius. I can take this trapezius tissue and sandwich it between my paired thumbs and my finger pads, and just draw it up and allow it to sit. And I can wait for that tissue to soften. Or I can just hang out for a little while and then move on. I have good success with both. Even if you don't feel that softening of the trapezius and the nearby tissue, I find that this still works. And at this point, I'll reach under, bring my fingertips to the opposite side of the cervical spine, and I can kind of encourage the head to come back up to neutral. So I try not to keep the head over to one side for too long. That can lead to a sore neck, especially in people who are prone to that kind of thing. And now I want to work with this shoulder, with this deltoid and the nearby structures. I want to work with the pec. So I'm using a broad hand, a broad duck grip to petrissage this shoulder as I spread the pec in the other direction. I'll be working with the pec a bit more as I work with the forearm and with the upper arm. But this is a good opportunity to start warming the area up and to introduce it to some fascial traction. Again, I'm staying somewhat near to this clavicle. Any opportunity that I can get to outline that clavicle, I think, is worthwhile. And using that duck grip, I can draw this deltoid tissue outward. Using paired hands, I can sit with that deltoid tissue for a while. This is another opportunity for client engagement. I could have my client rotate her arm in and out. And as I'm working, I like to make plenty of contact around this coracoid process. So the coracoid is part of the scapula that's jutting forward, and attaching to that is pec minor. And pec minor is a place where that impingement of the brachial plexus can happen, so between here and here-ish. So I do want to make contact just inferior to that coracoid and create some traction down. This can be a sensitive area in people who have shoulder stuff, people who have arm stuff going on. So make sure to track your client and feel free to ask. And now that I'm over to one side, I can start working more specifically with this shoulder while doing some passive movement. So I'm just kind of mobilizing this shoulder tissue. I'm pressing the humerus up toward that ball and socket joint. I'm including some outlining of the spine of the scapula using my fingertips. I'm drawing the tissue out distally and pressing it up proximally. And this is a good opportunity to mobilize this entire shoulder region. I like to pluck this wrist up, place it in the crook of my elbow, and now as I work with this shoulder region, just by gently rocking my own body, I can create some rotation of that humerus. I can draw out, create some traction, and press that humerus up into that glenohumeral joint. By pressing that humerus up, sometimes it can give a message to these surrounding muscles that they can release, that they can reduce some of their tone. And I can always offer some reintegrating contact. What I don't want to do with any massage that I do is kind of cut the body up into pieces. When I work specifically, I like to occasionally go back to broad. So this is my first opportunity to work directly with the areas of interest, and I still want to think oblique angles. I've got, once again, some jojoba oil. Not too much because I do want to move slowly. Instead of pressing in toward these epicondyles, I'm pressing down toward the table and then scooping this tissue up toward the ceiling. So at no point am I purposely pressing in toward the bone. Just that tiny shift in how you apply pressure can allow you to interact with these areas that are more sensitive. And the same goes with this region of this bicipital tendon right here. I don't want to interact with that directly. Instead, I want to work with this entire biceps. I'm creating traction proximally, and I am applying some pressure down toward the humerus. So this is working with the biceps, it's working with brachialis. And I can choose to allow this wrist to fall down toward the floor and come back up. So just slowly pumping the elbow into extension and flexion. I've got my hip up against the table here, my thigh, and by choosing how far forward I am, I can apply a different amount of pressure. So if I'm really far back, I need to apply more pressure just to take my own weight. But if my hips are further forward, I can lean forward without it applying a lot of pressure. And come all the way up toward that glenohumeral joint and beyond. If you'd like to get a little bit more specific, or just give a different feel to this, you can use different tools here. The further this arm is into flexion, the softer this anterior humeral region is going to be. So just be aware of that. If this area is too soft as you work on it, and you're displacing this muscle to one side, it's easy to interact directly with that humerus, or it can be possible to interact directly with that ulnar nerve, especially here toward the medial epicondyle, and that can be painful, and it could be completely counterproductive to what I'm trying to do here. So just make sure that you've got some muscle tissue between your fist and the humerus. In the future, as we find out how this region responds to the pressure that I've been using, I could have her take control of her lower arm and go into extension and flexion as I apply pressure, which could be quite specific, or I could continue using that broader pressure. So that's something that I can do in future sessions. Also realize that rotation of the wrist, so that supination and pronation, are going to affect the length and the position of the biceps. So I could also have her do some rotation. Now, as I get into working with these flexors and extensors, even though the pain has moved, I think that it's not unreasonable that there could be some interaction, at least on a fascial level, between these muscles being very tense and these muscles being tense. There could also be some irritation of the nerves that innervate this area. So if I can make these flexors and extensors happier, then this other stuff could end up happier too. So I'm going to start by alternating hands. It might look like I'm using my thumbs a lot here, but I'm placing them against the forearm and leaving them there. They're not pressing in with a lot of thumb tip pressure. I'm not having to use these muscles too much. I'm creating this shape and sliding down the forearm using that same shape. I find that one source of thumb stress is trying to do a lot of movement with this thumb as you apply pressure. So instead, I just make that C-clamp and send it down the forearm. And Jess, is there any pain as I approach this outside part of your elbow?
Nope.
All right, good. And right now I'm working on both sides of the forearm at once. I've got my thumbs working on the extensors while my fingers clamp the rest of the forearm, so they're working on those flexors. And just go ahead and take your fist and draw it down into a ball. And now splay it up and outward. And repeat that, down into a ball. Good. And up. And this is something that I find that I can usually do on the first session, but it's something that I might leave out if she still had active epicondyle pain. And allow your hand to relax. Now, if I want to work with these extensors more directly, I can grasp the anterior wrist with my close hand, with my left hand in this case, and use my other hand to apply this broad pressure of the open fist. If this isn't a comfortable position for your client, you can put a pillow under their wrist instead. And so here, I want to explore the anatomy of this posterior forearm. I want to work with the areas that are close to this ulna. I want to work more toward this radius. And something that you may have noticed is that there's some movement possible here. Because I have this wrist plucked up, I can just do a very subtle movement of the wrist using my thumb and my fingers, or rotation. So I'm not trying to break up anything here. I'm not trying to work with knots or adhesions or anything like that. I'm thinking from a myofascial perspective, and I'm just trying to iron this area out. And as I do so, I want to create new kinds of stimulus. This isn't about changing the fascia either. This is about using the fascia to give new information to these muscles by exploring these different facets of the extensors, and by doing so with the wrist in different positions and the elbow in different positions, I can help this region find a new homeostasis, find a new balance. And while my client is face down like this, I can do much the same as I did while she was face up, this time with the wrist flexors. So I'm going to stabilize the hand with my fist. So I'm just going to lean into this hand, and my other hand can glide up those flexors. This stabilization using my fist down here keeps that hand open, so that's going to create a bit of stretch for those flexors, because this hand would like to curl in as I do this move. And by resisting that, that's just some new stimulus and some new stretch. And as I move, especially if I'm using a sharper tool like this closed fist, I'm not going to approach too close to this medial epicondyle. Just as a reminder, this is the attachment site of most flexors, and just to the outside of it, just toward that olecranon process, there's this canal where the ulnar nerve runs, otherwise known as the funny bone, and impingement of that nerve can be unpleasant. So I definitely do want to angle my fist outward and work closer to that ulna. Just realize that the further proximal you go, the more exposed that ulnar nerve becomes. So stop short. If you do interact with this area, do so with a nice broad hand that's angled up, proximally toward the shoulder. You can also support this wrist as you work, and because these fingers are now free, you can allow that curling in to happen, or you can have your client do some movement. So just go ahead and open your hand wide. And now bring it down into a ball. And just repeat that. And as I explore these different portions of the flexors, I can feel her flexors contract and then extend. And as I work with the triceps region, I just want to start with a general warm-up. When there's pain just proximal to that olecranon process, I'm not thinking about breaking up this area. I'm not thinking about frictioning out this region. I'm thinking about this entire triceps. And once again, as you work with this area, make sure to keep muscle between the tools that you're using and their humerus. As you travel medially, it's possible to interact directly with that ulnar nerve, and that's not what I want. So just use some caution as you travel toward that inner arm. Once again, I'm supporting myself on my own thigh. I could also choose to lounge by putting pressure on the table, but I do like having this comforting mother hand here. And once again, this is an area where I could have the client do active motion of straightening that elbow and then bringing it into flexion. I can do that myself, but it's difficult to do without my back having to act as a crane. So this may be something that you want to do while sitting, and just gently bring that elbow partially in and out of flexion and extension, This can be a very small range of motion. Especially in early sessions, you don't need to bring the arm to full extension or to full flexion. It can be just a little bit of movement. And make sure to work all the way up toward the lateral scapula, where one of the heads of triceps attaches. And finally, I want to work with this entire shoulder region. So I want to work with these rotator cuff muscles. I want to work with these lateral thoracic muscles. I want to create a lot of space between the scapula and the humerus. These can kind of get glued together by tension here at the rotator cuff. So work with these muscles, work with the teres, work with lats, work with trapezius, and with the neck. So think locally, but act globally. All right, so that's how I go about it. Again, I try to work broadly. After that, I would go on to work with the rest of the body, and with the other arm, I would want to kind of even things out, especially because she's had pain in the other arm in the past. I don't want to just hyper-focus on that one side. Thanks as always to my Patreon supporters. I could not do this without you. I couldn't do this weird teaching thing if it weren't for you. Thanks for watching. Consider subscribing, and I'll see you next time.